Karen, thank you so much for being here with us today. I am so excited to sit down with you and talk about Intermountain and all of the great work that y'all do here in Salt Lake. And I have to say, before we start talking though, Sean met you guys and met your dogs when he was flying through the Salt Lake airport. So that's how we found out about your organization, and we just love y'all.
Yeah, that's great. Yeah, we started that airport program several years ago, and I have to be honest, I was a skeptic.
Really?
Yes, because I organized the waiting list of healthcare settings and assisted living centers and rehab centers that want programs. And so when the airport called, I'm like, why do vacationers need therapy animals?
Such an interesting point.
So it turns out that there are a number of cardiac incidents at airports.
Oh, I didn't know that.
So they asked us to come in to hopefully reduce those numbers of cardiac incidents.
Wow.
And the reception has been overwhelming. Travelers love us. Anxious kids, their moms come over and ask if we'll come see their child before they board the plane. So it's been a great program.
That
so
is
I'm glad we met you guys
awesome.
that way.
Me too. Well, I feel like we just kind of jumped into it, but I'd love to take a step back and hear how Intermountain started. How did you get involved? Kind of lay the groundwork for us.
Yeah, so Intermountain Therapy Animals has been around since 1993. Founded by 3 dogs, a Rottweiler, a German Shepherd, and a Doberman.
Wow, that is so
Not your typical
special.
therapy animals.
But I love that, breaking the stereotypes for all those years.
And it is. This kind of work is not about a specific breed. Mm-hmm. It's about temperament and skills. Mm-hmm. So they started it way back then. I came on board in 1996. We had about 30 volunteers. Fast forward, we are now about 110 facilities in the Utah area, 350 volunteers in Utah, a little bit in Idaho, a fairly large group in Montana. In addition to that, we have 21 other therapy animal organizations that are our affiliates, meaning they use our training and testing protocols, and we provide their insurance in 18 other states.
Wow,
So
that is so cool.
That little 3-dog thing that started here all over the country.
How cool.
Yeah.
I just love how therapy work, and what you said, it's not breed specific. Yeah. I love that there are dogs of all breeds that are out serving, because dogs are just, I mean, we're so blessed to have them. They give so much love, and I say this, I feel like every time I talk to someone about therapy work, but the walls that they can break down instantly without any words is something that could take us as people years to get to that point with someone.
Sure.
And it's just, it truly, I always feel like I have to fight back tears, but it's truly so incredible to see that. Like, we're just so blessed to have these dogs.
We are, and I always tell people, doing this job, I get told a lot, oh, how cute, you do dog work.
It is funny.
And it is cute, but I'm always like, oh, but it's so much more. There's physiological things happening.
Yes.
Blood pressure goes down, heart rate decreases, relaxation improved. If we go see somebody in the ICU, they require less pain management for the next 8 hours, you know?
Wow.
So it is cute for sure, but it's a lot more to it as well. And like you said, breaking down walls that humans can't sometimes.
I know. Yeah. Well, I'm so excited to hear your story as well. How did you get started with Intermountain Therapy Animals?
Yeah. So I had a Harlequin Great Dane named Maggie. She was a beautiful, sweet thing, and I just thought, gosh, I just want to share her. And so I read a little article in the newspaper about this therapy work. So I started with her, and we volunteered for 8 years. Primary Children's Residential Center and Shriners Hospital and all kinds of fun places. When she passed away, I, for some reason, changed to a rabbit. So I had a cute little
Great Dane to a
rabbit. Yes, she was black and white also. And we were mostly on call for the burn trauma unit at the University Hospital.
Wow.
Those little patients who are just so burned and fragile, they could just have this little rabbit on their bed or on their lap. And when they would call us and we came in, even if the client was in the middle of physical therapy, they would stop what they were doing to have this rabbit visit with this child for a while. So she was really fun. She also became a Read Rabbit. So Read is our reading education assistant dog program. And she learned to look at the book and, you know, I'll let the kids read stories to her. we had returning kids would come with books about good dental hygiene for her. And, so we had a good time with the rabbit. And then I went to a dachshund. So I had a little, again, I stayed with the black and white theme, a little dachshund I worked with for a number of years. And she was just a read dog. She was a wonderful read dog. She could sit in the lap and look at the pages. And then she passed along, and I now have a rescue dog who might one day want to do therapy, but he does a lot of therapy at home for me.
It absolutely counts.
So I get to live vicariously working with all these wonderful volunteers and hearing their stories right now.
That is so cool. I want to know so much more about your therapy rabbit.
Yeah.
Because that is not something we talk a lot about. I mean, we primarily with our work, we focus on dogs, and that's really our bread and butter, but talk to me a little bit about how it was training your rabbit and just what that looked like, because that's so cool.
Yeah, and I should say we have a few rabbits in the group. We have some miniature horses, a few cats. Cats that want to do therapy are amazing. We call them little dogs in cat suits. It's not happen often, it's usually very, very rare for a cat to want to do this.
Yes.
So, but my rabbit, it just happened that she had been brought up in a preschool, somebody that did a preschool in her home. And so she was around kids, she was litter box trained, and when I had lost my dog, he was actually my son's kindergarten teacher, and she knew I was in the therapy animal world.
Oh, wow.
She said, "What do you think about a therapy rabbit?" So
you're like, well, I
honestly,
didn't think about that.
It's the same as a cat. You can't really train them too much. They either are or they're not,
That makes sense.
Because she was litter box trained and outgoing, and she would actually play fetch. You could toss her a toy and she'd bring it back.
Well, that's more than Nash does. The retrieving aspect of Nash's breed, that gene is not strong in him.
So she just, they either are or they're not.
That's so funny.
The testing is very similar to a cat. They obviously don't need all the sit down, stay, come when called skills. They go to one lap and another 4 different laps, and they just have to stay there and not kick or bite anybody and have the right temperament. So,
I love that.
Yeah,
I love that. I love it. It's so interesting too, because a lot of people have a heart to do therapy work, and I love that. But it's not like you said about your puppy right now. He is just not ready.
Yeah.
And I think too, people are really hard on themselves.
Yeah.
Because I really think that an animal is either a therapy animal or not. And if they're not, totally fine.
Okay.
A lot of people shouldn't be therapists.
Yeah.
And I think then when people talk about that and they're like, well, I have a heart to do it, but my dog is just not a fit. And I'm like, that's okay.
Yes.
They do therapy work at home with you, and that is so important, and that still counts so much. So.
Yeah. And we just give people extra pats on the back when they recognize that about their dog, because so many of us, we want to do this so bad. I mean, I miss it, but I can see that my dog would not enjoy it. And so we never want to take our dogs visiting at the expense of their health and well-being. So,
right. I love that.
It's great when people recognize that.
I love that.
We usually try to redirect them to nose work or agility or whatever their dog might like.
I love that. You're like, this is not a great fit, but here's
What about
something
this?
else you could try. I love that, redirecting. That's perfect with training too. Well, thank you so much for sharing a little bit about what you do with Intermountain and how you got started. I feel like I could talk to you for hours.
Yes, we could.
All right. Well, thank you so much, Karen. I just loved chatting with you.
Me too. Thanks for having us.
Rachel, I just love you guys already. I am so happy that you and your sweet boy Jagger could be here with us today. But I want to dive in and talk about how you've gotten connected with Intermountain Therapy Animals, why you started therapy work, and why we're here today at Center for Change.
Well, we're so excited to be here with you. I have Jagger with us, who is a Newfoundland. He is almost 8 years old. We have been working at Center for Change, which is where we are here today, for almost 19 years. We've been volunteering here, and we first heard about Intermountain Therapy Animals on TV. We just saw a little blurb. We had a 4-month-old Newfoundland puppy 20 years ago, and we thought we need something else to do with him. He's bored at home, so we want to do something with him where we can take him and, he can give back like dogs often do. So we made contact with Intermountain Therapy Animals, and the rest is history. We just started training him, our first Newfoundland, and tested him a year later. They have to be a certain age. So we waited till he was ready, and this was the first place we came to work. Was Center for Change, and we've been coming for almost 19 years. So
I
awesome.
love that so much. Do you only serve here? Or do you guys also volunteer elsewhere?
We actually volunteer at Utah Valley Hospital as well in Provo, and we go there every week, and we come here every other week. So it's
awesome.
It's a fun little schedule, and we love volunteering, and we love being able to take our dogs with us. We have two of them. We have Jagger and Jinx.
Jagger and Jinx.
They're our little babies, and it's just awesome. We just love going to meet people and for them to meet our dogs.
It's pretty incredible, I think, when you get to do volunteering as a family unit, but also get to share your dogs or your animals, because we've talked about there's rabbits, there's cats that do this, but getting to share the sweet animals that we love so much and have that be our job it is unlike anything you get to do. It is truly so special.
Absolutely. And this last year and a half when we weren't able to go, we all had a void in our lives. Not just us, but our animals did too. They're like, why aren't we going? We're supposed to be visiting people. So we're so grateful that we're able to be back here and back at the hospital, and
I love it.
It's wonderful.
I love it. So how did you guys fill your time over the last year and a half?
We took them on lots of walks. And
lots of walks and
drives,
snuggles.
Lots of things that they could do without being at the hospital or here. So.
Oh, I can imagine that first day back, both here and at the hospital, the joy.
They were so excited. They just went trotting in like, this is our place. We know this place. They were so happy.
That is so sweet. I love that so much. I also would love to hear a little bit too about your personal experience on, you know, we always talk about how much therapy work impacts the people that you're there to volunteer and to serve. But the truth is that therapy work really does change you sometimes more than the people that you're volunteering.
For sure.
So I'd love to hear how therapy work has changed you and your husband too, because he also does work with Jinx.
We do it together.
But I want to hear about what has it been like behind the curtain?
We always tell people we are just the other end of the leash. We're in the background. We hope people don't even remember our names. We want them to know our dogs, but it is so fulfilling to just go and see the joy that you give to people. Like as we come here and we see the girls that just scream when they walk in the room and come and literally lay on top of them and lay beside them and give them hugs, and just the joy and knowing that our dogs are making people happy and helping them to get through what is really the worst part of their life at this moment, you know, where they're here at Center for Change.
Do you have any story that you feel like, whether it was spent here or at the hospital, like just doing therapy work, has there been one story for you that has stuck out more than any other?
Yes, it's a heartbreaking story, but just shows the power of animal therapy. We were at the hospital and we were just about ready to leave. We'd done all of our visits and we had a nurse come down and say, hey, you guys are here today. We really need you to come up to the ICU. We have a mom, she was 35 years old, had 6 kids. She'd had a stroke and they were gonna have to take her off life support within the next few hours. So they said, we have to come, the kids have to come and say goodbye to their mom. Can you just come up and just sit outside the room, and after they come out, they can just come and see the dogs. And so we're like, sure. So we went up and we sat, and our dog, he'd already been working, so he was very tired. So he kind of looked he read the situation, which our dogs do. They're amazing at knowing what they should be doing. He walked in and looked around and just sat right in the middle of the floor and just knew where he needed to be. And as each of those kids came out after saying goodbye to their mom, they just laid and cried on our dogs. And as we were leaving, we were there for about an hour as each of them said goodbye. And as we left, the dad and the grandparents both came and said, you will never know how much that meant to have you guys here. Well, this will be a positive memory in their life of losing their mom that day, that they had this, beautiful animal that was there to take their grief and to give them loves and to have a little happiness in that day. So that was just
man. You weren't joking that it brings tears. I have tears like welling up.
But it's amazing what these guys can do for people to help them get through any situation in life. So
gosh. Oh man. Oh, thank you for sharing that. That's really hard. And I think, because those kids probably were so varying in age.
Oh, yes, they were.
But the ability that you said you can have one positive in a really, really
Awful.
tough situation
Yes.
that you never want these kids
Right.
to face. You
Yeah.
have no idea the ripple effect that
Right.
had. And you just being willing just to say
Right.
yes. And I think that's so true with all therapy work. Like, it's just saying yes.
Exactly. And just
And-
being there,
and
just
just being
showing
there.
up. I mean, really, we're not
Yes.
the ones doing anything.
No.
We're just here while they do their thing. So
It's
amazing.
incredible.
We love therapy work, and we hope more people will do it, and we appreciate you guys spreading the word about it. We need more volunteers always,
Yes,
always.
yes, we
So,
do. And that's obviously our heart, but it's also
Right.
our heart with these interviews to be sharing these stories, because that has power.
Yeah.
And if people recognize that, because we all get so caught up in our days, you know, and we joke about being forgetful and having so much on our plates, but the truth is that this is so powerful. And if our dogs are a good fit, like, why not? You
Why
can
not?
do it at
Yeah.
you can do it at any interval,
exactly.
however often or
Right.
you know, least
Much-
often you can do
yes,
it.
that's
It
right.
matters. And I just think stepping up to the plate and raising your hand and saying yes
do it. Right.
is so
And it's
important.
so fulfilling, so rewarding, and you're giving back. So it's awesome, and we love it. And we love doing it with our animals.
I
so.
know. Well, I just love you guys.
Well,
thank you so
thank
much
you.
for all the work you do. We're so inspired by you, and I just love you, and I just love Jagger. I can't wait to meet Jinx next. Jamie, my friend, thank you for taking time out of your busy schedule to sit down with us and chat. And I'm just so excited to hear how you got started here and what this facility is doing with Intermountain to help change lives.
All good questions. Thank you for having me, first of all. So I got started here. I was at Oklahoma State University, and I was looking for a senior internship in recreation therapy. And I interviewed here, and there was just this really unique pull to the center. I had never really thought about working with eating disorders before or with that population, and there was just this unique feel to the center that I just thought, I really want that in my life. And I did my internship here, and I loved it, and I've been here since. And
When
so,
was that?
Last summer.
Okay, so about a year and a half. That's incredible.
Yeah, and so I love the center. It has just become a really big keystone in my life, and the people here are just incredible, and the patients and what we do here is just a really, really unique facility, and so I just feel so privileged to work here, honestly. We currently have 3 dog teams that come and visit our patients. They're on a bi-weekly schedule, so 1 week we'll have 1 team and 1 week we'll have 2 teams, and they'll rotate and visit all of the units on our facility when they come here.
Perfect. How many units are here?
So we have 3 residential units. So we have an inpatient unit. So generally when they first get here, if they are really malnourished or really struggling with eating disorder behaviors where they're purging a lot or over-exercising and really just are at a higher risk point, also suicide risk, self-harm risk, generally they'll be on their inpatient unit.
Okay.
Then when they're in a safer, healthier space, we'll move them to either our adolescent unit or our adult unit. And then we also have a day patient program where they'll be here from 9 a.m. to 3 p.m. And an intensive outpatient program where they're here from 2 to 6, so we can kind of help phase them out where life isn't as daunting, you know, with that transition, and really try to help set them up to live a recovery lifestyle as they leave here.
I love that. It's so cool because we just met, and seeing the joy on your face and hearing that, you can just see it. You can see your passion for being here, and
Yeah.
that is what places like this need. They need people that are just so enthralled with being here and help, and you can see that. And I just like really want to just tell you that, because
Thank
you can see that on your face, and it's
Yeah.
just so inspiring to see, because eating disorders are a real thing, and
Right.
it goes across every phase of life, across every economic status. It doesn't discriminate against people. And I think we were talking before, but I think living in the day and age that we have now is really, really hard because we have social media. And while social media can be such a blessing, it can also be really, really hard for society to tackle and to differentiate the normal and the not normal. And I think that that's really hard. And I feel like we could talk about that for hours too.
Yeah.
But I'd love to hear you know, for someone that's coming in, they're facing so much. And just talk us through what your process looks like. You know, if someone's coming in and they're really struggling, and how the dogs, how you've seen them help.
Yeah, oh man. Well, especially when they first get here. So we'll give them an assessment and try to ease them into the program. They get a dietitian, a therapist. We have a great team here. We have a lot of experiential therapy, which is really unique to our facility. So it's a lot of hands-on, giving them a lot of exposure to a lot of different coping skills that they can use to replace their eating disorder behaviors. So we do a lot of music therapy, art therapy, movement therapy to get them back in touch with their body in an intuitive way where they're not focused on counting calories and just more being present. And the dogs really help with a lot of that, which I don't think most people would think. But when they come, our inpatient unit in particular, we make sure that all 3 dogs, all 3 of our teams see that unit. Because these are a lot of patients when they get here, they are just struggling, they are overwhelmed with their trauma, and the way that they've been dealing with it has been with these eating disorder behaviors, whether that's binging or purging, self-harming, exercising, and now being in a facility where they're not allowed to do those things, they feel really out of control.
Sure.
And there's no sense of comfort for them because, you know, they are being asked to eat multiple times a day, and that's really challenging, and they're being, you know, they're not around their families, and to be here, that struggle right off the bat is really difficult. And so we see a lot of people that when they're initially here really shut down because they're so overwhelmed, and the self-worth that a lot of our patients have is just so sad to see. You know, they really don't believe that they're worth recovery. So when the dogs come in, it's, for almost all of our patients, it's the first time you see any joy, any lightness to their affect, and just their whole mood shifts with these dogs where they finally feel like, oh my gosh, somebody somewhere loves me unconditionally. I don't have to be perfect. I don't have to look a certain way. I don't have to eat a certain way. And just seeing this unconditional love that these girls feel when they're with their dogs is such a game changer that you really start to see this shift take place of, oh, I can do this. Oh, I am worth it. And even if it's not perfect, I can still be loved and I can love myself. And the dogs are a huge part of that.
Yeah, I bet. I just am so, you know, we see working and doing therapy work, we see these situations come up where like people, they see this dog and their whole atmosphere shifts. And it's so incredible to see that the support that they're getting from you guys and the support you have through Intermountain and how that beautifully comes together. I really do think that that makes lasting, true change. No pun intended with Center for Change. I mean, it's just it's so incredible to see that and to know that, I mean, as women, I know this is a question, are all the patients here women, or is it also open to men?
So our residential is exclusively for women, for people who identify as female.
Okay.
So we do get some transitional patients, but we don't get those as frequently. And occasionally with our day patient programs where they're not spending the night here, we will get men as well.
Gotcha.
But the majority of our patients are female.
Gotcha. Well, I was going to say, I mean, it's so hard, I think, as women, and I don't want to leave men out because I don't understand what men face too, but I can speak specifically as a gal. I mean, it's hard, and it's hard to not compare and to not play that comparison game. So even if, you know, people out there watching, even if they don't necessarily struggle with a full-blown eating disorder, I think we've all had that season of life where we're like, or if it's been ongoing, we're just not happy with what we see. But it all comes down to knowing that it's not what matters. You know, like being healthy is what matters, and I think it's really important to know and to see the dogs helping these patients understand that they're so worthy and so beautiful, whatever their body looks like, in a healthy way.
Absolutely.
That's just so, that means a lot. And I, like I said, I'm a lady, like I get it. Like I've seen that in my own life, and to know that when, for us, like when I look at Nash, like I know he loves me no matter how much money we have in the bank, what car I drive, what I look like, if I'm wearing makeup or my jams. Like it doesn't matter. He just loves me and he just wants me to play with him. So that is just so incredible that even though these patients are out of their homes and here, whether it's for the day or overnight for an extended stay, that they still get that bonding experience with these dogs, and it's something for them to look forward to.
Yes.
That's incredible to hear. I'm just so inspired by you guys. I'm so thankful that Salt Lake has you and your team. You guys are incredible. I'm just so, like I said, so inspired by you and just so encouraged. Is there anything that you want people to know, whether they're watching here in Salt Lake or anywhere else? Is there anything that you kind of want to leave with? It could be a testimony, it could just be something on your heart that you want to share, anything.
So actually we had something last night that reminded me of this. So we had a patient who I guess as a child was attacked by a dog, and that has been a big source of trauma in her life. And you know, because so many people are, I love dogs, dog friendly, you know, that's a big culture. That she's felt a lot of shame and a lot of embarrassment that she is scared of dogs. And so we have a team that comes. It's a smaller dog, it's a Cavalier King Charles. And she initially started by, I want to go in the room and look at the dog for like 5 minutes. And it's been several months now, and last night she was like, I want to hold this dog.
Wow.
And to go from I want to look at the dog to now I'm holding the dog and being, well, when's the dog coming back? When's the dog coming next time? And just seeing how that has changed her overall confidence and her overall self-image has really been incredible to just see like just that one change impacting her whole self-image.
I love that you pointed that out, and because that's so true. The fact of the matter is, like, and this is so broad, but we never know what someone's going through.
Absolutely.
We never know their past experience in any capacity. And you're right, the dog-friendly movement is so prominent, and we see that. I mean, we take Nash almost everywhere we go, but it's such a good reminder that not everybody has had a positive experience with dogs. And it's just, and we've seen it we were with a family that we kind of ended up meeting in Montana, and their kids were very standoffish with dogs. I just think they hadn't had a lot of experience with bigger dogs, and Nash, our golden, he's a bigger dog, and they just kind of same thing, like it was a very condensed period, but they started from like the outskirts with their mom kind of like tucked behind her, and then in like 20 minutes they were like rolling over him, but it just takes that positive experience at whatever pace for them. And again, like we've talked about in this interview so far, you never know the ripple effect that's going to have. And again, like dogs are really able to do so much that we can't in such a quick amount of time. And I love that she now has a positive relation with dogs. And King Charles are just so cute. They're just perfect puppy to start just that next step in her dog situation with. So I'm so glad to hear that. And you never know. I mean, again, the ripple effect, you never know what someone went through, and you never know what's ahead for them. You can only be there with them in that present state. And like I said, you guys are just doing such an incredible job with that. I'm so grateful for you. Thank you so much for sitting down and sharing that with us. I just love you, and I'm so proud of the Center for Change and everything y'all are doing here.